Hi everyone, welcome to my introductory video. My name is Samira Ali. I go by Sam. I live in Kansas City, Missouri, and I live with my husband and our three children. Yara is 11, Nally is 10, and Shushu is 6. She just turned 6 a couple of days ago. After high school, I went to Metropolitan Community College, and I decided I wanted to be a nurse, so then I transferred everything to UMKC and got my BSN from UMKC in 2007. Currently, I work on my master's in nursing education from MNU. It is kind of slow, but this is my 5th class, and what I hope to accomplish with my degree is to help new nurses and future nurses in my small way and prepare them for workforce. Whether it is through academia or staff development, I hope that I can help with the nursing shortage and give back to my nursing profession. I started working at North Kansas City Hospital as a nurse in 2007. It's been my primary place of work. I have worked in a couple other places, but I wouldn't change North Kansas City Hospital. That home feels like a home, and I know a lot of people through the years I've met and have gone through a lot with my coworkers. Currently, I work in PACU. I started working there in 2015, and most recently, about a year ago, I started teaching clinicals for Park University School of Nursing as an adjunct faculty, and that's been really fun. I really learn a lot as I teach that. Students, I learn through them just as much as they learn from me. So it's definitely give and take. Theory, I guess we were introduced in theory after we started, but when I first started nursing, I knew I just wanted to help people, and that was it. Nobody else in my family was a nurse before, and I was the first one graduating from college from my family. So when I started the program, theory and research was introduced, and really through the years I've learned theory and research are the backbone of healthcare, and more specifically nursing. You know, the why we do what we do and how we do it is really important. I hope that I continue to learn, and this course is definitely feels that way, that I'm going to be learning a lot about theories and research and build on what I already know. I help with a drape study when I was at UMKC. One of our OBGYN professor was a midwife also, and she wanted to do this drape study that was ultimately going to help women in third world country that didn't have access to healthcare. And the study was we would put a drape under the laboring mother, and during delivery, if there was any blood, the drape had a pouch. It was a plastic pouch, and it had a measurement on it. And so based on that blood loss, it would give the doctor or the nurse midwife if the mother lost a lot of blood, and it was it's an indicator if they were going to be needing blood transfusion or future plans for this specific situation. So ultimately it was going to help mothers. It was honestly pretty gross because I did not have kids before this study, and so I was kind of doing it, but I learned so much through the study. I love this quote: "Life is like an onion, you peel it off one layer at a time, and sometimes you weep," by Carl Sandburg. I wanted to show this, but also I feel like this is parallel with nursing, because just like onion, there are so many layers to nursing, and through all the layers lies the heart. You have to have the heart for nursing it is so hard to take care of people sometimes. It's exhausting physically, mentally. I don't need to preach, you guys. You already know. But when you have the heart of a nurse, it really changes, your perspective, why you're there. It's not an accident that you're there for that situation, for that patient, their family. So, I really love this quote, and I kind of use it as my metaphorical for nursing. This was proven, true during the recent pandemic. Nurses were the closest to patients, even though we were scared for ourselves, for our lives, and, potentially infecting our family members, but we still took care of patients and we carried on. I think nursing is noun and verb. It's noun because we are educated and trained in our field, and then it's verb because we take care of unwell people and help them through tough diagnosis, treatment, procedures, etc., etc. So it really is both. My favorite knowledge is power. The more you know, the more powerful you are. I love all kinds of knowledge, and I take full advantage of technology and look up things I don't know all the time. And so, you should always learn new things, whether it's in your career, whether it's for your personal, you should always learn. It's just really important. After reviewing the webcast, the one with Cagna, theories guide nursing practice and generate knowledge. It helps to describe nursing. And, again, why we do what we do for our patients is really important. And then the webcast for a safe toolkit, patient safety and quality of care is important, and how we have much work to do to change the culture of safety. It has gotten improved. We have so much more to do, though, because there's still a lot of safety issues and other things that are happening that could be better. Hobbies and work, I guess school related. I love reading, sewing, and organizing. So any of these things put me in my element. I love spending time with our kids. My husband and I have made conscious decision to spend a lot of times with our kids and to be constant in their life. So for that, we do things that are like, it involves all of us. We practice soccer as a family. We walk as a family, and we eat one meal, at least one meal as a family. Interesting thing about me, I was 16 years old when my family and I left Northern Iraq and we came to the United States. I started learning English here, and at this time, I learned English from scratch, is what I tell people. So I graduated from high school at age 21, and so I was 17 when I started, and they put me in freshman class because I didn't speak English, and so I worked my way up. I'm very proud of the work I have done, and I'm not done. I continue to learn and be a life learner. I really thank you for watching this presentation, and I'm looking forward to seeing all of your presentations.